Are you always tired, gaining weight for no reason, losing hair? Your thyroid might be screaming for help, and you're not listening. I'm Dr. Emily Carter, a therapist and gerontologist, and today I'm going to tell you the 7 warning signs of thyroid problems that you absolutely cannot ignore. Your thyroid is a small gland, but when it stops working properly, it affects your entire body. Let me explain. First, what is the thyroid? It's a small butterfly-shaped gland in the front of your neck, just below your Adam's apple. It's small, but it's incredibly powerful. Your thyroid produces hormones that control your metabolism, your energy, your body temperature, your heart rate, even your mood. When your thyroid isn't working right, nothing in your body works right. There are 2 main thyroid problems. Hypothyroidism, that means your thyroid is underactive, not producing enough hormones. And hyperthyroidism, that means your thyroid is overactive, producing too much hormone. Both cause serious problems, but the symptoms are different. Today, I'm focusing on the 7 most common warning signs. If you have several of these, you need to get your thyroid checked. Warning sign number 1, unexplained fatigue and weakness. You sleep 8 hours, you wake up exhausted, you feel tired all day, every day. You have no energy to do basic things. You feel weak, like your muscles don't work properly. This is one of the most common signs of hypothyroidism, an underactive thyroid. Your metabolism is too slow, your cells aren't getting enough energy. You feel like you're dragging yourself through the day. Many people ignore this. They think it's stress or age or just being busy. But if you're constantly exhausted despite adequate sleep, your thyroid could be the problem. Warning sign number 2, unexplained weight changes. For hypothyroidism, you gain weight even though you're not eating more. You might even be eating less and still gaining weight. Why? Because your metabolism has slowed down. Your body is burning fewer calories. Everything you eat gets stored as fat. This weight gain is usually around your belly, hips, and face. You feel bloated and puffy. For hyperthyroidism, the opposite happens. You lose weight even though you're eating normally or even eating more. Your metabolism is too fast. You're burning calories too quickly. Either way, unexplained weight changes are a red flag. Warning sign number 3, hair loss and skin changes. Your hair is falling out more than usual. You see it on your pillow, in the shower, on your brush. Your hair becomes dry, brittle, thin. The outer third of your eyebrows might thin or disappear completely. This is very common with hypothyroidism. Your skin also changes. It becomes dry, rough, pale, sometimes yellowish. You might develop puffy areas, especially around your eyes and face. With hyperthyroidism, your skin might become warm, moist, and thin. Your hair might also thin, but in a different pattern. Warning sign number 4, changes in heart rate and blood pressure. With hypothyroidism, your heart rate slows down. You might have bradycardia, a heart rate below 60 beats per minute. Your blood pressure might drop. You feel dizzy when you stand up. With hyperthyroidism, your heart rate speeds up. You have palpitations. Your heart pounds. You can feel it racing even when you're resting. You might develop irregular heartbeat, atrial fibrillation. Your blood pressure might go up. Both conditions are dangerous for your heart. Don't ignore changes in your heart rate. Warning sign number 5, temperature sensitivity and sweating changes. With hypothyroidism, you're always cold. Everyone else is comfortable, you're freezing. You need extra layers. Your hands and feet are ice cold. You can't warm up. This happens because your metabolism is slow and you're producing less body heat. With hyperthyroidism, you're always hot. You sweat excessively, even in cool rooms. You can't tolerate heat. You feel like you're burning up. Your hands might be warm and sweaty all the time. Warning sign number 6, mood changes and brain fog. With hypothyroidism, you feel depressed, unmotivated, your brain feels slow, you have trouble concentrating. Your memory is poor, you forget things constantly. People call this brain fog. You also might feel anxious or irritable. With hyperthyroidism, you feel anxious and nervous all the time. You're restless, you can't sit still. You're irritable and moody, you might have panic attacks, your mind races, you can't relax. Both conditions affect your mental health significantly. Many people get treated for depression or anxiety without realizing the real problem is their thyroid. Warning sign number 7, changes in bowel habits and digestion. With hypothyroidism, you become constipated. Your digestion slows down. You might have a bowel movement only once or twice a week. You feel bloated and uncomfortable. With hyperthyroidism, you have frequent bowel movements, sometimes diarrhea. Your digestion is too fast. You might lose appetite or have nausea. Now, there are other signs too. For women, thyroid problems cause irregular periods, heavy periods, or periods that stop completely. They can cause fertility problems. For men, thyroid problems can cause low libido and erectile dysfunction. Thyroid problems can cause muscle aches and joint pain. They can cause hoarse voice or difficulty swallowing if the thyroid is enlarged. They can cause high cholesterol that doesn't respond to diet changes. Who is at risk for thyroid problems? Women are much more likely than men. The risk increases after age 40. If you have a family history of thyroid disease, your risk is higher. If you have other autoimmune diseases like type 1 diabetes, rheumatoid arthritis, or celiac disease, you're at higher risk. If you've had radiation treatment to your neck or head, if you're pregnant or recently gave birth, if you've had thyroid problems before, the most common cause of hypothyroidism is Hashimoto's thyroiditis. This is an autoimmune disease where your immune system attacks your thyroid. The most common cause of hyperthyroidism is Graves' disease, also autoimmune. If you have several of these warning signs, what should you do? See your doctor and ask for thyroid function tests. The most important test is TSH, thyroid stimulating hormone. This shows how hard your pituitary gland is working to stimulate your thyroid. High TSH usually means hypothyroidism. Low TSH usually means hyperthyroidism. Your doctor might also check T3 and T4, the actual thyroid hormones, and thyroid antibodies to check for autoimmune disease. The good news is thyroid problems are very treatable. For hypothyroidism, you take a daily thyroid hormone pill, usually levothyroxine. This replaces the hormone your thyroid isn't making. Most people feel much better within a few weeks. For hyperthyroidism, treatment options include anti-thyroid medications, radioactive iodine to destroy part of the thyroid, or surgery to remove part or all of the thyroid. Don't ignore these warning signs. Don't think it's just stress or age. If your body is trying to tell you something is wrong, listen. Get tested. Get treated. Your thyroid is small, but it controls so much. Take care of it. If you recognize these symptoms in yourself, see your doctor this week, not next month, this week. Your health matters. You deserve to feel good. You deserve to have energy, stable weight, healthy hair, a calm mind, and a strong heart. Take action. Be strong.